Hi there, how are you doing today? That's great to hear. I just wanted to introduce myself as we haven't seen one another before. My name is Dr. Rose. I am one of the student doctors here today, and I am just going to be conducting your full body daily check, if that's okay. Fantastic. If we could just start by, if you're able to show me your identification wristband. Thank you. If you could let me know your full name and your date of birth. Lovely. And do you know what day it is today? And the year? Fabulous. So if you're happy for us to get started, you are? Okay, lovely. We will begin by taking your vitals. That will include your temperature, your heart rate and your blood pressure. Yes, okay. So I am just going to use an electronic thermometer and read the temperature on your head and also in your armpits as well, okay? Alrighty. Lovely, and if we can just move your gown here. Thank you. And then the other side as well. All right. Now, is there an arm which you'd prefer us to take the blood pressure from? This arm's okay? Alright. I'm sure you're used to this by now. Yeah. Just going to leave that on there for one more moment. If you are feeling unwell at any point, do let me know, okay? Right. And now we will take a little listen to your heart and your lungs as well. So once again, I am just going to need to move the robe. Now I am just going to go behind you. If you can sit forward a little bit for me, just so I can have a listen to your lungs. Thank you. Your weight taken this morning? You have, okay. Oh no, they make us sign off each section that we do complete. Right, so the next step of the exam is me just taking a look over your entire body just to make sure there are no discolorations in the skin, any hot patches. Yeah, just checking for any rashes or anything that might be concerning to us. I will be moving the gown in certain places, but you will never be fully uncovered. Okay. Alright, so I'm just going to take a look at your head here. And just sectioning the hair to look at the scalp. If I could just ask you to sit forward again for me, I just want to take a little look at the back of your head. Thank you. Just feeling for any abrasions. Okay, so now just looking at the face here as well. Everything seems equal. Nothing seems hot. And just feeling your neck here. Again, no swelling. Okay, and your chest. Just your upper chest along your clavicle. I'm just going to feel the lymph nodes here. And just your armpits there as well, okay? Alright, so I'm just going to have a look at your arms. Other arm here. That's good. And then we're just going to take a little peek at your stomach. Okay, and then your legs as well. Need to ask you to make a couple of facial expressions for me. Can you raise your eyebrows? Can you do a nice big smile? Can you frown? Can you squeeze your eyes really tightly shut? Okay. I now do want to do a couple of inspections on your eyes. I'm going to start by just taking a little look at your eyelids and eyelashes. If you're able to close your eyes for me. Yes, I will just pre-warn you, I am going to be using a small little torch from now on, okay? Okay, so close your eyes. Thank you. So just checking the skin is okay. Eyelashes are full and healthy. I will also just ask you to open your eyes. I'm going to measure your pupil here. Okay, pupil is 4 millimeters equal. I'm now going to take a look at your conjunctivus, your sclera, and also your corneas. So if you can keep your eyes open, I am just going to pull down on your eyelid. Okay, and the other eye here. Okay, I'm going to place a hand in the center of your face and just check the pupil is reacting as it should. Fantastic. I'm going to ask you to look up, down, left and right. Alright, so if you start by looking up for me. Super. If you can look to your left. Great. If you can look down. When you do look down, I am going to pull up on your upper eyelid, okay? So if you look down. Alright, and the other eye here. Alright, and then if you can look to your right. Thank you, Poppet, we're almost done. With the eyes, I should say, excuse me. Okay. Okay, I am just going to ask you to follow my finger. Please do follow with your eyes only and not your head. I'm now going to bring my finger closer to your face and then further away. Try to follow as best you can. Is that uncomfortable or painful at all? No? Okay. Alrighty, can you let me know when my fingers do leave your peripheral? Okay. That's great. Have you had any issues with hearing? Alright, just going to examine the external of your ear here. I will just take a very quick look with the light. This shouldn't affect your vision at all. Okay, externally ears look okay. I'm just going to inspect your tympanic membrane here. Perfect, it's a lovely grey colour. Light accumulation of wax, but that is very normal. I'm now going to do a couple of soft sounds besides one of your ears, and I just need you to tell me which side it is coming from, okay? Yeah. 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 That's great. Just want to take a little look at your nose and its symmetry. If you can look up slightly for me, I just want to make sure we have no signs of any deviation in the septum. Okay, if I hold one of your nostrils, can you blow out for me? Good, and the other one. Fantastic, and I'm just going to grab this here and ask you to smell it and let me know what you think it is, okay? It's an alcohol wipe, yes. Okay. Alright. Just popping some fresh gloves on here. I'm just going to have another little look at your sinuses. And the lips here as well. Lips are a little dry, but you are in an air-conditioned room, so it could just be the recycled air is just causing your lips to dry out a little. Can you open your mouth for me nice and wide? Fantastic. And if you stick your tongue out, just a pre-warning, light will be used again. Alright, if you can put your tongue to the roof of your mouth. Good. If you can put your tongue to the right side of your mouth and the left. Okay. Can you clench your teeth together like this? Thank you. If you stay like that. Good. Keep your teeth clenched. I'm just going to feel your jaw here. You can relax. Okay. Gums were okay, teeth were okay, palate okay, tongue okay. You feel having tonsils, examine jaw, that's fine. Alright. Just want to have a look at the range of motion in your neck. Alright, so if it would be easier for you, I can hold your head and we can do it together, or if you do feel comfortable enough, you can do it on your own. Together? Okay, so I'm just going to hold you very gently like this, and we're going to move your head this way. Is that feeling okay? Good. And then we'll move you this way. And you're still okay? Lovely. So let's pop you back to the middle. No pain in the neck at all when we were doing that? Okay. We've checked the lymph nodes, so that's fine. No signs of any rashes on the neck at all as well, so again, all good there. Need to sign off this section. We are now going to do a pulmonary examination, so we're going to have a listen, more in-depth listen, I should say, to your chest and the chest wall. This will involve me moving the gown, excuse me, will involve me moving the gown, okay? Alright. Right, so I'm just going to examine your chest again very quickly. If I palpate your chest, can you just let me know if you have any pain at all? Okay. Okay. So that's fine? I am going to just have a listen on the sides of your chest to begin with. So I'm just going to feel for your pulse in your neck here, and then also in your wrist, in your elbow, and your armpit. I'm going to repeat that on the other side too. So the wrist, the elbow, and the armpit. what I'm going to ask you to do is again sit upright for me, and I'm going to oscillate down your back. Yes. Yes, you're welcome to lay back. Okay, so we're going to do the musculoskeletal examination now. I'm going to start by inspecting your legs, mainly the knees. This will involve me checking that range of motion and also their strength as well. Okay, so we'll start with your left leg. Okay, I'm just going to begin by palpating. Good, and then I'm going to just bring your knee up, so bend your leg slightly for me. Thank you. Is there any pain when you're doing that? Alright, if you pop your leg back flat, I'm just going to rotate your leg side to side. Any pain at all there? Okay, what I want to do next is place my hands on your shins and ask you to try and lift your leg up. I'm going to place my palm flat against the sole of your foot, and I'm just going to ask you to push down. Okay, and I'm going to push back and you need to resist me. Okay, good. And with the thigh here, any pain? Okay. We'll just do the other leg here. So again, we'll start with the palpating. Bring leg up, so knee to chest. Is that okay? Good. Just holding your shin. If you try and lift your leg up. Good. Hand on sole. If you push for me. Okay, and now resist. Good. And any pain in the thigh. Thank you. Let's do your shoulders next. So I'm just going to cover your legs back up here. And let's just expose your shoulders. Okay, so same process again. I am going to start by palpating. Thank you. Okay. Good. Is there any pain there at all? Okay. I'm going to place my hands on your shoulders and you're going to try and lift them, and I'm going to push down. Just having a little look at your arm here and here. Good. How have your hips been since lying in the, or being in the position you are in for some time? You're okay, so you're still all good to walk around? Fantastic. Any issues with the spine? Any back pain? Okay. Right. To assess your sensations based on my touch, okay? So I'm going to do equal side placements of touch, and I need you to just confirm you can feel it equally on both sides. Yeah? Okay, here we go. So that's equal. Okay. Equal. Okay. Equal. 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 If you can just place your arms directly outward like this, I'm going to press down on top of them and you keep them up. Okay, now we'll do a swap, so I'm going to place my hands under and you push down. Good, fantastic. Can you bring your arms up close to you like this? And I'm going to try and pull them away. Good, and this one. That's great. Okay, now I do want to have a little listen to your stomach. So we're going to have a listen for bowel sounds to begin with. I do also want to do a general inspection of your abdomen. Okay, so once again I am just going to move your gown to one side. Okay, so I'm just going to have a little look over your stomach to begin with. Have you been having any stomach troubles at all? And any issues with using the toilet? Just before I begin with listening for bowel sounds, I am just going to press on your tummy. Now I do have to use a fairly intense amount of strength. It shouldn't be too uncomfortable, but you are going to feel it. Okay? If it hurts at all, you just say. Alright? I don't want you to be in any intense pain. You still okay? I know, we just do have to kind of press. Okay. Right, now I'm going to have a listen to the bowel. and then we will do some percussions on all four quadrants, excuse me, of the abdomen. I'm just going to do the liver's edge here, okay? And spleen tip. Okay. What I may suggest is we do a very quick ultrasound just on your tummy. Would you be okay with me doing that? Okay, fantastic. So I am just going to leave you like that for the moment with your gown just to one side. And I'm just going to bring my computer up here, okay? So I'm just going to apply some jelly to your stomach. Okay, so I'm just going to use my ultrasound probe here. And just press that against your tummy and just look at the monitor. You're welcome to look at the monitor, it's just to your right. I don't know if you do know what you were looking at though, but you okay? Good. Yes, sometimes we do have to press a little bit harder, I do apologise. I'm just taking some pictures here. We'll be finished soon. Is there anything that you need from me before I do leave? Okay. Or is there anything you want to tell me, just about how you're feeling? Any changes at all? Okay. Yeah. I understand. Okay. Well, I am going to, let's just sort this out for you. I am just going to go and consult with the other doctors with reference to your ultrasound. If you do feel wildly unwell at all, please do ring the emergency alarm and we will come see you. It may be me that does see you tomorrow, I'm not 100% sure at the moment, but we will do the same checkup then if it is me. Otherwise it will be one of my fabulous colleagues, okay? Alrighty. Well, it was a pleasure to look after you, and I really do hope you feel better soon, okay? Just try and get some rest. No worries, take care.